eliminate disparity. The only way that I can truly see to eliminate disparity in our society is to have a single-payer system. Medical care for everyone, across the board. Now,
Is that your question?
my question is, why isn't it on the table? Why do we have lobbyists to the tune of $1,000 an hour being paid in Washington to pay our politicians to vote to support them and not the people? This is not people's health care. This is health care for big business and politicians. This is not right. That's my question. When are we really going to advocate for change,
Well,
Senator?
let me try to answer this. First of all, there is a lot right with our healthcare system. The quality of care in America, as far as the academic centers, the research that's done, is second to none in the world. So I don't want to dismiss that. Secondly, let me tell you that most people in America are satisfied with their private health insurance coverage. There have been surveys done this past month on that specific question. The majority of Americans are satisfied with their private insurance coverage. I'm not saying whether they're right or wrong. That's where America is on it. And then lastly, on a single payer, the president's not supporting a single payer, and there is not the support in Congress to pass a single payer. I personally believe that diversity is good. Competition is good. I believe in private insurance, but I do believe in a public insurance option so that we have true competition. I think that's the best model to use. I support the president. Yes.
My name is John Cook. I'm from Annapolis, Maryland. And my question to you is, you're touting this health care program tonight. If this health care program, number one, is so good, why did Congress exempt themselves from participating in it? That's one thing. And I want to comment on two other statements you made.
Well, sir, we're just going to take your question because our time is running out, and it seems that you're asking if it's so good, why did Congress exempt itself? That will be your question, and then we're going to move on.
Let me assure you, first of all, that Congress has not exempted itself from any of the provisions here. So to make that clear, there is no exemptions from Congress whatsoever. We will be in the plan. The only thing I can guarantee you is that we will be covered like anyone else in the plan. And secondly, let me say one thing. There is no plan today, okay? There is no plan. We have a couple committees that have reported. There's been no floor action in either the House or the Senate. Where I work in the Senate, we have unlimited amendments. I can assure you there's going to be a lot of effort, including by this senator, to change the bill on the floor of the United States Senate. So I just urge you all to stay tuned. We don't have a bill yet. I can tell you that Congress and federal employees will be part of the plan. There's no bill to read right now. We have a committee report. I have read the material from the Senate Education Health Committee, which has reported out a bill, and from the Senate Commerce Committee that's reported out a bill, and the Senate House Commerce Committee and House Ways and Means Committee. These are going to be brought together before there's a bill brought to the floor in either the House or the Senate. We're not there yet. All I can tell you is we don't have a bill yet.
One place I will tell you, ladies and gentlemen, that we are is almost at the end of this town hall meeting. We will take one last question from the lady here. I will remind you that you can send all of your questions to www.cardin.senate.gov, and we'll take the last question, and then we'll thank the senator for hosting this town hall meeting.
My name is Alvinia Singleton, and my question concerns Medicare Advantage plans. I'd like to know what is the Senate's position on the continuation of Medicare Advantage plans as an option for Medicare beneficiaries.
Medicare Advantage are the private insurance plans available to Medicare beneficiaries. They can choose a plan. In many cases, you pay an extra premium for it. You go into the plan, and it covers more than basic Medicare. The problem is, when we started the private insurance option within Medicare, it was an effort by private insurance to say they could save the taxpayers of this country money. So what the government did originally is give the private insurance company Care First. A check for 98% of what it cost in traditional fee-for-service Medicare. And then they provided the benefits. Actually, it started at 95%. It went up to 98%. It went up to 100%. Today, it's about 115%. So for every senior that's enrolled in Medicare Advantage, it costs the taxpayers of this country more money than for someone who enrolls in fee-for-service traditional Medicare. Now, the extra cost to the system is a couple $100 billion. It's a lot of money. I'm conflicted here. I like private insurance and competition. I think it should be a level playing field. I don't think it should be overly subsidized. On the other hand, I like the extra benefits that seniors can get in the Medicare Advantage plans. But I don't think we can continue this rich subsidy. So I think it's something that needs to be talked about. There's no recommendation to eliminate the full subsidies, but there's some to try to put caps on it so that there's fairer competition between private insurance and the public option fee-for-service in an effort to try to bring down the cost of the Medicare system. And with that, let me just, if I might, Dr. Dukes, one last point. This has been spirited. That's good. That's good. I come back to the point, and quite frankly, those who have been critical of some of my positions have basically also been urging for change. There's a few who I think would like to see the status quo maintained. I feel very passionately, as the President of the United States, Barack Obama, feels the status quo is unacceptable. We just can't allow the continuation of this. I have serious concerns about a lot of the proposals that have been made by our committees. I have concerns about them. I'm going to be offering amendments to try to strengthen this bill. We didn't talk at all tonight about how we're going to pay for this. I have serious concerns on a lot of the financing mechanisms. Serious concerns. And yet I agree completely with the President that it has to be paid for. We can't go more into debt. We can't do that. So we're going to have to pay for it. What I just urge you, this is the first of the town hall meetings that I've had on, and Jack, you have a spirited constituency here. I wish you well. It will not be my last. We do have town hall meetings scheduled in Baltimore and in Montgomery County and on the Eastern Shore. We are scheduling these around the state. I need to hear from you. I just asked you to be respectful in the way that you communicate, because I think we can learn from each other. I very much respect your views, including the person who challenges whether an individual mandate is correct. I think that's a legitimate argument to make, and we should have that discussion. I think if we have an informed discussion, we're going to reach better results. We live in the greatest country in the world, and I really do believe we're going to get this right. We're going to fix our health care system so that America can not only brag about having the greatest health care centers in the world, but a system that provides quality, affordable health care for every family in America. That is our goal. Thank you all very much for being here tonight.
Thank you all, and have a great evening.
You were great. This guy was great. I'm telling you, I'm stealing some of his lines.